My name is Shattuck, and I am the medical director of the Division of Sleep Medicine at St. Mary's. It's important to get a good night's sleep because sleep underscores a whole bunch of important things for us. So if we don't sleep, it's harder to think, it's harder to have healthy reaction times, so it's harder to be able to drive. So it can make it really difficult. In addition to that, you just feel lousy. I know that if I sleep better, I just feel better. Things just look different. I'm more energetic, I'm more positive, and I've had some bouts of insomnia. So I've had periods of time where I slept really poorly. God, everything just looks kind of bleak if you don't sleep well, and you can just feel more negative and just feel more easily overwhelmed. Sleep disorder breathing, including sleep apnea, probably is our most common diagnosis, then followed by insomnia. We see a lot of it because it's very common. And despite the fact that it's very common, probably 80% of men and 90% of women are still undiagnosed for sleep apnea who have that condition. So there are a couple different kinds of sleep studies. And there's the in-lab sleep study, which is traditionally what we've done, but there's also a home sleep study. So an in-lab sleep study is pretty comprehensive, and conversely, a home sleep study is easier to do, but it really is a test for sleep apnea. The kinds of treatments we offer depend on the diagnosis, of course. So for somebody who has a diagnosis like restless legs, we're going to make sure that their iron is fully repleted. We might use medications. For insomnia, the first line therapy for chronic insomnia is cognitive behavioral therapy for insomnia. And we have a group that we've developed at St. Mary's that meets for about 7 weeks and meets cyclically that teaches the skills for people to manage their own insomnia. And it's very successful. In terms of sleep apnea, the treatment does focus more on sometimes equipment, sometimes CPAP, but also oral appliances, and there's other modalities that have become available as well. So it might be referral to a surgeon. So it's really tailored to what's going on with the patient, how severe their disease is, and what their preference is. But we try and have a wide range of options available that include medical devices, medications, and then sometimes different kinds of therapies. I think the reason that I really enjoy sleep medicine is that it just brings together a number of different things that I enjoy. So you have contact with patients and you get to follow them over time. You get to improve something very tangible for patients. So people are very thankful when they sleep better. I mean, it's a real relief. And not sleeping well, some people would say it's almost a form of pain. It's a form of sleep pain. So when you feel sleep deprived, you feel groggy, you're not thinking clearly, everything is just, twice as hard at least. So being able to help people with that really is really nice, and people appreciate it. And it's something that can happen relatively quickly in some cases. In order to get a referral to the sleep clinic, it depends on one's insurance. Many insurances require a referral through their PCP, through their primary care physician. Some insurances you can refer yourself. So it really depends. But if you call our office, we'll go ahead and we'll navigate through that process with you. If you need a referral from your PCP, we can call your PCP and ask them to put a referral in to facilitate that process.